For Scientific American Science Quickly, I'm Rachel Feltman. I'm joined today by Dr. Jasmine McDonald. She is at Columbia University's Mailman School of Public Health. Thank you so much for coming in to chat with us today.
Thank you for having me.
So I know that you study breast cancer, but can you tell me more about your particular area of expertise?
I got my training in basic science, and I was very interested in signaling pathways and how those pathways are associated with disease. And now I'm a molecular epidemiologist. And so I'm very much interested in the progression of developing breast cancer, but how that happens across a woman's life course. So from in utero to pubertal to postpartum, those periods of time where we know the breast tissue is more sensitive to outside assaults or exposures and how that plays a role in developing breast cancer.
And what has changed about breast cancer risk or diagnosis in recent years?
There's been an increase in early onset breast cancer. So this means that there's an increase in young women developing breast cancer before the age of 50. Some even define it as developing breast cancer before the age of 45. This is very concerning as cancer is usually considered a disease of old age. You have to live long enough to develop cancer. But now we're seeing that this rise in early onset, it's not just breast cancer, they're seeing in colorectal cancer and some other cancers as well. But what's very concerning is that many of the subtypes of breast cancer, for young women, there's a high frequency of diagnosis of triple-negative breast cancer or estrogen receptor negative breast cancer. And what this means is that the tumor itself is going to be more aggressive. There's going to be challenges in treating that particular tumor. Outcomes are going to be somewhat worse when you have this particular subtype of breast cancer. And not only that, if you think about it, these women are quite young. Therefore, even surviving the diagnosis, they have the rest of their life to continue to live with this higher risk of developing a new cancer diagnosis or a recurrent breast cancer diagnosis.
And when we look at those rising rates, what are we seeing at the demographic level?
So the rising rates are seen pretty much all over. I mean, even you can see it in Ghana, you can see it in India. Like it's really a global experience. But we know that Black women, women of African ancestry, are diagnosed at earlier, younger ages. They're more likely to be diagnosed with the aggressive breast cancer subtypes like estrogen receptor negative, and they're more likely to have worse outcomes. And we know that Black women have a greater mortality compared to white women when it comes to being diagnosed with breast cancer. That means dying from the disease.
Right. And I definitely want to talk some more about what might be contributing to that disparity. But before we get into that, what makes it difficult to study cancer risk?
Cancer is hard to study because it is a disease of age. You have to live long enough to develop cancer. It's not something where you are exposed and then boom, you have the disease, like an infection. This is something where there's a mutation. That mutation can be harmful or not harmful. That mutation can cause another mutation, et cetera, et cetera. But it's a long, latent process. Therefore, when you're thinking about epidemiology and you're looking at what causes cancer, oftentimes what caused the initial mutation or progression may be very distal or far from the diagnosis. And so that makes it very challenging, especially people consider cancer like, oh, like cancer's everywhere. Yes, it is. However, in order to study it, you need a very large population. And that means that when you're thinking about an exposure, smoking and lung cancer. Well, there was a time where there was a very high percentage of people who were smoking. So that was something you could study. But with breast cancer, there's so many different causative agents that we consider that you need a very large population to really understand exposures. And that makes it very challenging cost-wise, as well as you need to follow from the time that event happened 20, 30, 40, 50 years in the future.
Wow. Yeah. So what are you doing in your research to try to answer those questions?
So we look at intermediate outcomes. One of the things I really am interested in is periods in life where we know the breast tissue is dividing very rapidly. This is in utero. So I've looked at women who were exposed to pesticides in the womb and their mammographic density, meaning the density of their breast. This is when you get a mammogram. And now when you get a mammogram, it tells you if you have dense breasts. We know that breast density is associated with a increased risk of breast cancer. So it's like an intermediate biological marker.
Right.
I study puberty. We know that an earlier age that a girl starts breast development and the earlier age that she starts her period, the greater risk for breast cancer. So as an intermediate, you can look at exposures that are associated with an earlier age at developing puberty. So you start looking at intermediate markers and risk factors that are associated with breast cancer if you can't follow them for 20, 30, 40, 50 years.
Yeah. So what kind of associations are you finding?
There's different things I've looked at. One is looking at environmental exposure as it relates to pesticides. This is when young kids were running behind the fog trucks.
Right.
And it was a pesticide for mosquitoes, but it was used on crops. It was used at the pool. It was used everywhere. Where those, I guess, fetus that were exposed in the womb, they have denser breasts. It's also been shown that they have a higher risk of developing breast cancer if their mother also develop breast cancer. We also look at personal care product exposure. So we've shown that the use of certain hair products, especially like hair oils, is associated with an earlier age of starting one's period. And this was especially in Black girls. And we do see that Black girls develop pubertal markers much earlier than their counterparts. So you can see as young as age 5, African-American girls developing breast. And that is a biomarker for developing a high risk factor for breast cancer.
So you mentioned groups in particular where you find the rates of cancer diagnosis really concerning. So what do you think is leading to those disparities?
So disparities often result from when there's something you can do about it, that's when disparities arise. So if we think about the incidence rate of breast cancer, typically it's always been that white women have a higher incidence rate, as in like being diagnosed with the disease, and Black women have a higher mortality rate. Now, the rate of being diagnosed with the disease is pretty much equivalent for Black women and white women. And when we think about mortality, the reason that it's spread is because of the invention of like the mammogram, which allows you to detect it early. Detecting a tumor early is the best prognostic way to survive from that diagnosis because there's more that you can do and you are catching it hopefully at an earlier stage, a lower grade, and your outcomes are much better. But once you put in that technological advancement of mammograms, that has to be equitably available to all populations,
Right.
regardless of demographic. When that doesn't occur, disparities exist because there's one population getting the benefit over the other. So you'll start seeing those benefits in the statistics of our nation. So when there's something you can do, disparities will arise. I think when it also comes to exposures, socially disadvantaged groups have a higher burden of certain structural, environmental exposures. And so one thing that we study is the inequity as it comes to beauty standards. Mm. And so when we think about our normal routine as a woman and waking up and doing our hair, putting on lotion, all of those things, spritzing ourselves, it's not that different. However, we know that Black women, given the nation's beauty standards or the societal, it's not even our nation, I mean, it's global, right, societal beauty standards. Even in India, there's a high rate of using skin lighteners that contains metals, which are carcinogenic, to achieve lighter skin, because lighter skin is more beautiful, it's more acceptable, it's more societally advancing. So in the United States, straight hair is more acceptable. I've known people who got fired for having cornrows, who worked in the back of a shop, wow, didn't even see customers, and still got fired for wearing cornrows.
Wow. Yeah.
So that means that there's been products that are overburdened in a certain population that is not experienced in other populations, right, like perms and relaxers. And perms and relaxers are something that are unique to the Black experience. It's also something that starts very early in age. It's also something that's chronic usage. Mm-hmm. It's not a one-hit problem. Once you start using it, you usually have to continue using it unless you cut off all your hair.
Right.
And do the big chop. So we're talking about young age of exposure, repetitive exposure cumulatively, and this all plays a role in having an overburden of adverse chemicals like endocrine disruptor chemicals, carcinogenic chemicals, that increases your risk of having cellular mutation, and that cellular mutation being advantageous for tumor progression or tumor initiation to progression.
Yeah. I think a lot of people, when they think about cancer risk and read about cancer risk, they see a lot of stuff about lifestyle that can be, really very frustrating and unhelpful. What needs to change at the systemic level to address this stuff?
Systemically, people can't be blamed for the environment that they live in.
Right.
I mean, it's just not fair. I mean, there's only so much an individual can do. And sometimes what the individual is doing is overridden by the environment.
Right.
Like, we know that endocrine disruptor chemicals have their hormonal agents that can disrupt our natural hormonal system. Our hormones are linked to so many things. It's bidirectional communication with our immune system. It's linked to periods, it's obesity, everything from birth outcomes. Like, it's so pervasive. But yet, we don't really acknowledge that endocrine disruptor chemicals are in our food packaging and our personal care products. If you go into buildings that smell really amazing, they're just environmentally pervasive. But yet, we as an individual are supposed to individually change our lifestyle and behaviors to decrease our breast cancer risk. I think societally, there needs to be federal regulations that reduces our exposure to these toxicants, because there's only so much an individual can do. And why do we blame the individual for developing cancer?
Right.
Cancer is not something, yes, radiation, okay. But even pilots who fly all the time,
Yeah.
there's something about it where cancer is one of those things where they say, well, it's your fault. Like, you did something. You could have done something to prevent this. And that's not truly the case. I have a friend who, ridiculously healthy, just makes her own granola healthy.
Yeah.
And developed breast cancer.
Yeah.
At a young age. There was no lifestyle factor that would have contributed to that.
Yeah. I think speaking from personal experience for a few family members who had cancer at a young age, I think a lot of that stuff comes from people's fear. They want to feel like they're in control of their future health. They want to feel like there's something that they're doing that's going to prevent that from happening to them. As you said, a lot of systemic stuff is way bigger of an issue. The personal blame, totally inappropriate, unhelpful. But I think a lot of people listening to this or watching this who maybe aren't thinking about personal care products, for example, might want to know what they can do to avoid these exposures. So what advice do you have for them?
So my advice is that, when you're picking out a product, especially when we're talking about personal care product, that's going to go directly be absorbed into the largest organ of your body, the skin, or going to be directly absorbed by your scalp, things that are going to just sit on you. You want to make sure you're selecting products that are less toxic. When you see a product that says fragrance, that is a synonym for phthalates, which are endocrine disruptor chemicals that have been associated with a number of adverse health outcomes, including preterm birth. If you see parabens, those are endocrine disruptor chemicals. I also don't believe that individuals need to get a chemistry degree to pick a product. So there are different apps out there where you can scan the product if you're in person with your phone. If you're buying a product from Amazon or Walmart, there's Clearia, where when you select it, it's a little app that tells you if it's very harmful or what harmful chemicals are in it. So there are ways to choose a healthier, non-toxic product that's affordable as well. Because a lot of people have the concern is there's no way I can change my behavior because I can't afford it. But there are affordable, less toxic products. And we also have to really consider our children. Usually they don't have the autonomy on what gets placed on their body or their hair. They're often using either baby products or toddler products, which also may be quite harmful. Even No-Lie Relaxer that was made for young Black girls contains chemicals that are banned by the European Union Cosmetic Directive.
Wow, yeah.
So we also have to be considerate, are we using products in our household that are household friendly for everyone? I also suggest just changing things over time. It can be very overwhelming to say oh my gosh, I have to change my perfume, my lotion, my mascara. It is a lifestyle. It is a habit. It is a routine. And as long as it took you to find that perfect shade of eyeshadow, well, now you have to discover a perfect shade of eyeshadow that is less toxic and have fun with it.
Right.
You know, like don't make it such that you're adding stress because stress is also carcinogenic. So,
Great point.
so, you know, have fun with it, but choose that item that you cannot go without.
Right.
And then change that. And then
Yeah.
choose the next item and then keep going.
Right.
I also say that, you know, when it comes to plastics, don't microwave food in plastics. Don't eat hot food out of plastics. Avoid using plastic spoons and forks when you're eating hot foods. This may mean that you have to replace one Tupperware for another. This means that you may have to invest in a really nice water bottle over another. But these are long-term investments that have long-term health benefits because you are reducing your exposures.
Right. And I love the point you made about going slowly because, you know, I think it can be easily lose sight of the fact that every little change you make is a good change.
Exactly.
And it's often way more sustainable to do it that way than try to clean your house out all at once.
Exactly. And the thing is, like, people don't realize, but some of these chemicals have a very short half-life. That means, like, you use them, you pee them out. You use them, you pee them out. The only reason they are so harmful is because we use them routinely.
Right.
It's part of our routine. So even though they get metabolized and they're out of your system very quickly, you do something every day and every day. And every day. So they're just consistently, chronically, you're exposing yourself. That's why changing your routine, you know, just saying like, okay, you know what? I have to wear this particular eyeshadow. So let me go to XYZ store to find something that is clean, less toxic. And see how I like it. And then keep going like that.
I'm sure a lot of viewers and listeners will want to check out some of the apps and other resources you mentioned. So we'll definitely include those in our show notes so folks can find them.
Yes. And I just want to also say there's, for your listeners who have of African ancestry, Breast Cancer Prevention Partners has a Black Beauty Project that highlights different Black-owned companies that are producing clean, non-toxic products. For example, Sienna Naturals is Issa Rae and Hannah Jope's new line. And I'm only saying that because I use it and I do enjoy it. But there are many, many products. A lot of people feel like, okay, especially as a Black woman, like, is it even going to work? Like, I already have like pretty much a store in my house of products that I no longer use because they don't work. Don't let that deter you from changing your lifestyle. Don't give up. You didn't give up when you found the perfect shampoo in the first place. So don't give up for finding like that perfect alternative.
Yeah, that's great advice. Thank you so much for coming on to chat today.
Oh, thank you so much. I really appreciate it.